One of the things that drew me into joint replacement specifically is the ability to return that patient back to their normal way of life in a relatively quick period. Hip replacement is a phenomenal procedure to begin with, and our patients do quite well. And that's with the traditional approaches and the traditional techniques, but I'm always trying to get better. And so for me, HipInsight was a way to improve accuracy of the acetabular component and with a very small footprint. So the patient comes to see me in clinic and we indicate the patient for a hip replacement. From then the patient will go get a CAT scan. Now, that CAT scan is used to build a holographic model of the patient's bony pelvic anatomy. I'll get that plan preoperatively. I can move the components on the preoperative plan. I can see the size, the fit, the shape, and make sure it's tailored specifically to that particular patient. We'll go to the operating room. I'll make my approach to the hip through the HoloLens, the headset that I wear, and we'll have a holographic overlay of the patient's normal anatomy in the hologram. I'll line up my holographic representation of the instruments along with the real instruments and implant those components to where we had planned preoperatively. The hip is a ball and socket joint. The ball in it articulates within the socket. This is the femur that moves back and forth. A hip replacement and using HipInsight technology, we're able to more accurately position the acetabular component. By more accurately positioning the acetabular component, we decrease the likelihood of dislocation. It's relatively new technology. We're the first in the state to use it, and I've been very pleased with the outcomes.